Welcome to this video of frequently asked questions about total hip replacement. My name is Pete, and I call myself Future Pete right now because I'm about 2.5 years post-op. And that's important because I've learned a lot, both through my own experiences and by interacting with thousands of other hippies on my YouTube channels, my Facebook groups, and on my website. So I've taken a lot of that information, I've listened to what people are asking, and I've tried to compile some of those frequently asked questions. In today's video, we're going to cover the following questions. Is it time for me to get a total hip replacement? Is it normal to feel depressed? Which surgical approach is best? How will I be sedated? Will I be able to walk or climb stairs right after surgery? Just how useless will my operative leg be right after surgery? How do I get enough sleep? Will my artificial hip be a problem when flying? When can I drive again? If you want to jump to one particular question, just look in the video description where I've chaptered everything. And you're going to want to watch till the end where I'll share some additional frequently asked questions that are answered in their own dedicated videos. I wanted to share some great resources if you haven't already checked them out. I've made it easy by including links in this video's description. My website, hipvlog.org, contains lots of helpful resources, including an email system that will send you timely tips and information directly to your inbox throughout your hip journey. So I hope you'll take a minute now to invest in your recovery by subscribing to my YouTube channel, website, and Facebook groups. If you like my content, please share it with others and check out my other YouTube channel, Game of Life 411. Who knows, we might have some other interests in common. Thanks for watching, and now back to the video. One of the first questions many of us have is, what exactly is a hippie? I'm just kidding. No, really, one of the first questions most of us have is it time for me to get a total hip replacement? It's a complicated and personal question, but if you'd like to see how I thought through this and made my decision, you can watch this full-length video. But for right now, Mike, my co-host, is going to share with you some warning signs that you might be ready for total hip replacement. When we talk about total hip replacement, we spend a lot of time talking about the physical aspects of surgery and recovery and things like that. But there's also the emotional side, and you shouldn't really underplay that. So one of the questions you might have is it normal to feel depressed or to have other feelings about my total hip replacement? I wanted to touch briefly on the emotional well-being of patients who have been diagnosed with hip arthritis. I admit to having felt some depression. I would not classify it as severe, but it's not a good feeling to find out that your body is breaking down. If you're feeling that, to a large extent, you probably need to seek some help. I do kind of feel like my body's betraying me. I'm having to accept that pain is a part of the aging process. And so at this point, I just need to accept my limitations. I need to accept the pain that I'm going through, although I know that I can have the surgery and make it better with some intent and perseverance. So accept and persevere is kind of the state I'm at right now. I try to dispel those depressing thoughts whenever they pop into my head and just focus on the positive and focus on making the situation better. I've heard that some surgical approaches are better than others, and I've even heard that there's robotic-assisted surgeries now that are even better. Is this true? Which surgical approach is best for total hip replacement?
Many of my viewers ask me what type of procedure I had when I had my total hip replacement in January of 2023. A lot of times they're asking this question because they think that the approach makes a big difference. But I don't think that's necessarily the case anymore. What I've learned is that most modern medical approaches seem to have good outcomes and quick recoveries. So personally, I think the important thing is to find a good surgeon, one that you trust, and one that has a low complication rate. If that surgeon is talking to you about restrictions like not being able to bend past 90 degrees and things like that, then you're probably dealing with someone using antiquated methods, and you should probably look for a different surgeon. I had anterior, but a flavor of anterior called anterior-based muscle sparing. And it involves going through a certain muscle group that's different than the traditional anterior approach. So what I've found is, again, with posterior, with anterior, there are multiple approaches. They're going in through different muscle groups, they're approaching the surgery slightly differently. There's a third approach called lateral, but that seems to be less common. 10 or 15 years ago, it appears that it was very important to know whether you're going with an anterior approach or a posterior approach, because the posterior approach typically had greater range of motion restrictions and involved cutting more muscle. What I've learned is that today there are many different forms of anterior and posterior approaches. They're called muscle sparing, they're called robotic assist, they're called superpath. They have many different names. But again, the good news is, from what I can tell, all of these approaches seem to have very good outcomes and speedy recoveries due to all the advancements in medical science over the last decades.
I'm really worried about anesthesia. I've had a bad reaction to anesthesia in the past. How will I be sedated for total hip replacement?
Another question I often see is about sedation. A lot of people are under the impression that they're going to have an epidural and are wondering what type of sedation that they'll encounter during surgery. In my case, I had what's known as a spinal block. That's not the same thing as an epidural. An epidural is when they insert a catheter and there's a constant feed of anesthetic into the spine. That's often used during pregnancy and childbirth. But a spinal block is a single shot into the spine. It numbs that area. And then in my case, they used an anesthetic called propofol, which is the same anesthetic used for colonoscopies and other procedures. It has the advantage of leaving you more aware, yet you forget everything that happened during the procedure. It's got a cute nickname, milk of amnesia. And it really is true. I was really interested to see that in the doctor's notes after my surgery, he documented conversations that he had with me that I have no recollection of. So I'm very glad I don't remember the surgical process.
When will I be able to walk and climb stairs after my total hip replacement?
What's the recovery? Can she walk? You can walk immediately. So you'll start with a walker, then you go to a cane. I know. Wait, for real?
Did you know you can walk immediately after total hip replacement? Kris Jenner didn't. Actually, while you're in the hospital, they're going to get you up out of bed, you have to go to the bathroom, you have to be able to navigate a few stairs before they're going to discharge you from the hospital. This is something that's unique to total hip replacement and different from most other major surgeries. During my recovery from total hip replacement, I picked up a piece of wisdom from a website called bonesmart.org, which is run by orthopedic surgeons. And it goes like this. Hips actually don't need any exercise to get better. They do a pretty good job of it all on their own if given half a chance. Trouble is, most patients don't give it half a chance, and they end up with all sorts of aches and pains and setbacks. All they need is the best therapy, which is walking, and even then, not to excess. This is also why about 50% of surgeons who perform total hip replacements don't recommend any formal physical therapy at all during the recovery. Unless there was a significant pre-existing condition, like you'd been compensating for a year or two, then really walking is all you need. If you're facing total hip replacement, I hope you found this helpful. Please post a comment and let me know how soon after your total hip replacement you started walking. Just how useless will my operative leg be right after surgery?
Similarly, when you're getting in and out of a car, it's hard. You kind of like put your bum in and then you rotate, right? Well, there's a lot of friction on your backside. So one of the suggestions someone mentioned was take a pillow, put it in a plastic bag, and that'll slide really easily. So again, I wish I'd known that sooner, but hopefully you can benefit from my loss. Some other tips for moving that useless leg: you can use your non-operative leg to help lift your operative leg. Just kind of hook your foot under it and then lift it up. You can use a leg lifter, which is sort of a long thing with a hoop on the end. I call it an invisible dog leash because that's kind of what it looks like to me. But you hook that around your foot and then you can use your arm strength to lift it up onto the bed or to lower it down off of the bed. And then finally, one of the things that I did a lot was use my own body weight as a counterweight. For example, I would put my backside on the bed and I would grab onto my operative thigh, and then I would just kind of rock backwards. So holding my arms in a fixed position and using the rest of my body or my upper body weight to lift that leg into bed.
How do I get enough sleep? This was a real challenge for me, both pre-op as well as post-op. So I've shared some tips, and honestly, they're the same tips whether it's pre-op or post-op. So hopefully this will help you. There's also a helpful guide on hipvlog.org, which outlines my sleep strategies. So if you want to refer to that as a handy reference, you can do that as well. Will my artificial hip be a problem when flying? The short answer to this is no. I have done a ton of flying since my total hip replacement about 2.5 years ago. I have traveled to 3 different continents and really had no problem. Based on my experience, I think I can safely tell you that it's really no trouble to travel after total hip replacement.
Welcome to my hip FAQ about air travel after total hip replacement. I'm about 13 weeks post-op, and today I have my first flight. I'm going to visit my parents in the Chicago area, and so I'm just out for a morning walk to kind of loosen up my legs, but otherwise trying to take it easy because I'm going to be cooped up in a plane for a couple hours and then driving in a car for a couple hours to get to my parents' house. So I'll be curious to see how things go with the TSA and getting through security with my new hip. Hey Mike, are you here to wish me bon voyage? Anyhow, he's here with me as I get ready for my trip. Here's what I got packed. The bag on the right is all my camera gear because I'm going to test drive a Corvette C8 this weekend. And the bag on the left is my luggage, so hopefully they'll let all this pass. This is my son Xavier. He's going to drive me to the airport today.
Yes, sir. Personal chauffeur.
Well, that was pretty interesting. So going through the safety checkpoint, they have scanners where you raise your hand above your head and it scans around you. It detected my artificial hip joint and passed me. So I asked the guy and he said that the new software just does this automatically most of the time, not every time, but most of the time. So I didn't have to get patted down or anything. Surprisingly too, my camera gear bag with tripod and everything else made it through just fine. And then they isolated my baggage for my clothing and stuff because I actually had a very small metal can opener in my toiletries bag. I forgot it was even in there. So they found that and unfortunately I had to confiscate it. But otherwise, it was a breeze getting through the safety checkpoint. I'm surprised how easy that was.
In some cases, they have very sophisticated scanning devices that can identify these artificial implants and they'll just pass you right through. In other cases, they might flag you and require a pat down, but I've never had anything more serious than that.
I'm here in Raleigh-Durham waiting for my flight. As I mentioned, that security checkpoint was extremely easy with my artificial hip. So I'm going to try and record my experience when I come back through O'Hare because that's going to be a very different airport, and I know that the TSA protocols and checkpoints vary a lot from airport to airport. Hey, so far so good. Just got into Chicago O'Hare. Unfortunately, we had a mechanical issue. One of the overhead baggage bin doors was malfunctioning, so we had to wait about 45 minutes before we got to take off. So I sat in the plane for 3 hours, and that was not great. I had a little bit of aching in my hip joint, but thankfully I booked exit row and had tons of leg room. So all in all, not bad. Okay, I'm back in O'Hare and getting ready to go through security. We'll see how it goes with the new hip. Okay, just went through security at O'Hare and it was actually the same deal. I went through one of the things where you put your hand over your head and they just passed me right through. So that's awesome. Very easy with the total hip replacement. Well, I'm home after my first air travel trip following total hip replacement. Today is actually 13 weeks post-op and I feel pretty good. I left my parents' house about 8 hours ago, so I was in the car for a couple hours, sitting in the airport for a couple hours, then sitting in the airplane for a couple hours, and got home about an hour or so ago. I think everything went pretty well. Obviously, can still feel my hip joint a little bit. I was a little bit uncomfortable. I didn't take any kind of painkiller or anything on the trip out to visit my parents. On this trip back, I decided to take 2 Tylenol, just kind of took them during the flight. Because I want to make sure I don't have a lot of discomfort so I can get a good night's sleep tonight. But again, everything was pretty good. I did pay for seats that had extra legroom, and I think that really helped. And I'm glad I did that. So at any rate, successful trip, no problem. Happy to be home and not in too much discomfort.
When can I drive again? And this is a complicated question because there's the can you drive, and then there's is it safe for myself and others sort of question. And I try to explain that in this full-length video as well as the following short. But Basically, you have to make a judgment call. We've all driven in situations where maybe we weren't 100%. So after hip replacement, you're going to be on medications that could affect your reaction times and things like that. You're also sustained a lot of injuries that still have to heal. So your reflexes may not be as fast, or you may not have the strength to react as quickly or as strongly as you need to in an emergency situation. It's a complex issue, so you really have to think it through and make your own best informed decision. One of my viewers recently asked when one can start driving after total hip replacement. My surgeon's only criteria was that I be off the narcotics and have my 2-week follow-up visit with him. But as with almost everything, different surgeons will tell you different things. And if you live in the UK, you're not allowed to drive for 6 weeks after surgery by law. After my 2-week checkup, I asked my wife to drive me to a nearby parking lot so I could see if I could drive. I could, but not safely. My driving leg was my operative leg, so it was weak, and my strength and reaction time would be compromised. I could have driven, but I didn't think it was fair to others to put them at risk this way, so I waited until about 4 weeks post-op to resume driving. In the meantime, I worked on the strength and flexibility necessary to get in and out of my tiny Alfa Romeo sports car. This actually took about 10 days, and you can see how I approached it in this video. That covers the most frequently asked questions about total hip replacement. And now, as promised, I'm going to cover some additional frequently asked questions, ones for which I have a dedicated video. If you are pre-op, then many folks are asking, what should I buy? What do I need to do to prepare for my surgery? All those sorts of questions. I have a great video for that. It's my pre-op checklist, so you'll want to check that out. Similarly, I have a post-op guide, which is just chock full of amazing tips and information. And that was actually a big collaboration with a bunch of other hippies. It's actually very easy to find information in that video because everything's been chaptered. You just look in the video description and you go right to what you're looking for. Am I doing enough, or have I overdone it? Those are also frequently asked questions. And, I think one of the biggest challenges with this type of surgery is that because of the minimally invasive muscle sparing techniques, you actually feel really good really early after surgery. And so it's common to overdo it and suffer a setback. Usually those are minor, but sometimes they can be major. So to answer those questions and hopefully avoid setbacks, but if you're suffering with something, then to at least be able to tell whether it is a setback or is it a normal ache and pain, watch this video. Am I walking enough? If you're not sure, you could check this video where I've documented my walking progress from day 1 all the way through 4 months post-op. So you can see when I take my first hike on an unpaved trail. You can see when I first walk on a beach. You can see when I drop the crutches and then I drop the walking sticks. So all those sort of things. Now, bear in mind that our hip journeys are all different and you might progress faster or slower than I did, but we all pretty much hit the same milestones. When can I resume sports or whatever other favorite activity you have? Well, this is the video for you, and it's also got a very helpful companion guide where I've laid out how I would approach returning to various sports and activities. How do I manage pain both pre-op and post-op? This video might help you figure that out. How soon can I get back to the gym and start exercising and getting fit again? Well, I've got a couple videos that show the exercises that I was doing at various stages of my recovery. So things that are hip friendly and that you can slowly ease into. I think that covers it. Thanks for watching and have a great day.
It's your world and I'm just a squirrel trying to get a nut to move your butt.
Explore all the free resources and helpful information throughout your hip journey by joining the Pete's Hip Vlog community and subscribing to my YouTube channel, Pete's Hip Vlog. If you like my content, I hope you'll also check out and subscribe to my primary channel, Game of Life 411, where my goal is to help you win at the game of life, whether that means finance, family, fitness, or something else. And remember, you're in charge of your own health.